Hello, welcome to the 7th active movement session brought to you by PACES Sheffield and Connections Neuro-Disability Services. Today we're going to be working in mid-level upper body movements in a seated position. So we've been through a whole range of different activities and a whole range of different movements in all sorts of positions over the last 6 weeks. So now we're going to revisit some of those positions and just gradually build the challenge up slightly for you. So hopefully you've enjoyed what we've done so far, and hopefully you'll find this a bit more of a challenge today. If you haven't joined us before, please do make sure you go and look at some of our other videos. Like I say, they're all different movements in all different positions, but it's quite useful for this session being a mid-level, that if you start with the lower level session first to know where your ability is, and then if you feel like you're ready to come onto this session, then brilliant, and please do. So just before we start, there's a couple of things I need to share with you. One is about keeping safe and one is about the equipment we need. So keeping safe, what I want you to really be sure of is if you're taking part in these activities at your own home with the help of someone or by yourself, that you keep yourself safe and work within your abilities. We do want you to be active. We do want you to be joining in and pushing yourself, but we want you to do it safely. So please just judge your own abilities as best you can and be careful. And similarly, if someone's helping you to do the movements, please be aware of just judging how much help they need and who needs help. Similarly, if you could make sure to seek the advice of a medical professional before doing any online movement videos, not just the ones from us, but just to make sure that you keep yourself safe. So make sure a medical practitioner has told you that it's safe for you to do these sorts of movements. These are quite low level still in terms of no weight bearing and so on, more than sitting. So they should still be quite accessible, quite a number of you. So if we get started then, the things you're going to need today, like I say, we're seated. So I've got a dining room chair. If you sit on a dining room chair and are able to free sit, that is perfect. If you need support in sitting, you can use a therapy bench, you can use a wheelchair. Just things to bear in mind in that situation. If you're in a wheelchair, for example, if your wheelchair is tilted backwards, try to tilt it upright so you're in a nice upright sitting position. If you have extra support for perhaps your upper body, chest straps, lateral supports, neck supports, if you're able to remove some of those to give yourself more freedom in your upper body whilst we're doing today's activities, that would really help. But just do so safely and carefully as we go along. You can always change it. You can always pause, rewind, repeat, skip bits that don't work for you. So I think that's everything. We can get started. Oh, the one thing I haven't said, sorry, is that we'll need a couple of bits of equipment. So we've used these long sticks before. You'll have spotted them in the last few weeks. This is can be a broom handle, it can be a rolling pin, or it can be a stick just like mine, but just a piece of dowel about the sort of same size as your grasp is ideal. It does just need to be as wide as your shoulders from the point of view of being able to hold things shoulder width apart. And similarly, we're going for shorter sticks today, but if you haven't got short sticks lying around and you don't want to chop your long stick in half, you don't need to chop up your broom. But what we need is maybe a hairbrush, a spoon with a thick handle, a pen even will do. It's a little bit thin, but it'll do. A marker pen would be really good. So just a couple of shorter, stubbier sticks would be great. So let's get started. Now, as with every session we do, the important starting point for us is that we have a good posture in our starting position. So for today, that's a good posture in sitting. So whether your feet are on foot plates, whether they're on the floor, whether your bottom is strapped into a wheelchair, or whether you're free sitting on a therapy bench, what we're trying to do is get our best posture all the way through. So that means bottom right back in the chair, on whichever chair you're sitting on. It means getting a 90-degree angle at your knees, your heels and your hips to try and get you sitting as upright as you possibly can. Okay, so if you need to pop a cushion under your bottom, or perhaps a telephone directory under your feet to try and adjust the height of things, then please do just fiddle around a little bit. You can always pause and do that. But otherwise, we're trying to stretch our arms down because we're using our arms today and go for a best position with our arms. So bringing those arms down. If your arms stay here, tend to be very tight up towards your body, that's okay. Just try and loosen them to start with. So try and bring them a little lower than usual. And that's our best starting position. Hopefully by the end of what we've done, you might feel them a bit looser again if you've done a good job of it all. So I bring my hands down. My back is straight. My head is up. My feet are flat. And I sit straight. I sit straight. 1, 2, 3, 4, 5. Lovely. So what we're going to do is just do a couple of breathing tasks, fill up our chest with oxygen, get our body oxygenated and get some energy running through it, ready to move. So when we do this, we're going to lean forward and backwards to blow the air out and pull the air in. If you're able to lift your arms up whilst we're doing that, please do. If that's a bit much for you and you just want to use your body like this, or even if you want to stay sitting and just focus on the breathing, that is absolutely fine. Do what's right for you. So I lift my arms up, close my lips and breathe in. I bring my arms down and breathe out. Arms up, breathe in. Hold it for a second. Arms down, breathe out. And really try to reach towards the floor as you come forward. Arms up, breathe in. And arms down, breathe out. And then now, as you sit up and breathe in, you're not bringing your arms up, you're just coming to sitting. Sit up, breathe in. And then breathe out. And return to kind of normal breathing. Okay, hopefully you've got a bit of oxygen now going around your body and we're ready to begin. So we're going to start holding on to our long stick. Now, before when we've held the stick, we've held it with 2 hands this way. Today, we're going to hold 1 hand underneath and 1 hand on top. We're going to start with our left hand turned under and our right hand over. Okay, so the best way to probably do it is have someone hold it in front of you or have it resting on your knee, and take a grip with 1 hand and then the other. Okay, so whether that's at height here or whether that's on your knee, that's absolutely fine. So I hold on with my right hand, I hold on with my right hand. 1, 2, 3, 4, 5. And then I turn my left hand over and hold on with my left hand. I hold on with my left hand. 1, 2, 3, 4, 5. Lovely. Okay, so just a couple of pointers in this position. We're keeping our arms shoulder width apart, and you'll see my thumbs are pointing outwards. If possible, try and keep your thumbs pointing outwards. You can have them wrapped around, but just be careful that they don't pull underneath your hands or aren't inside your fists like this. So trying to keep them out of your hands. And the other thing is trying to keep your wrists turned down a little bit. So we're not letting our wrists sort of keep limp. In this position, we're trying to get a dynamic twisted position at our wrists, okay? So now you've got that position, you're going to try and straighten your elbows a little. You don't need to push them too far to too straight, but you need to try and get them a little straight. And then I lift the stick at chest height. I lift the stick at chest height. 1, 2, 3, 4, 5. And we're going to twist the stick so that your right hand comes down and your left hand comes up. Okay, so I twist the stick to the right. I twist the stick to the right. 1, 2, 3, 4, 5. And I bring it back. I bring it back. 1, 2, 3, 4, 5. I twist the stick to the right. I twist the stick to the right. 1, 2, 3, 4, 5. Aiming to get that stick so that it is now vertical from a horizontal position. And I turn it back. I turn it back. 1, 2, 3, 4, 5. If you have one arm that is a little weaker than the other, really focus during this movement on trying to lead the movement with your weaker side, especially if you had maybe a stroke or something like that. Really try to push from the bottom or from the top to try and lead that movement from your weaker side. Your stronger side will follow, and it will mean that your body is more active and more involved in that movement. So one last time, I twist the stick to the right. I twist the stick to the right. 1, 2, 3, 4, 5, and I bring it back. I bring it back. 1, 2, 3, 4, 5. Fabulous. And then I turn my right hand over. My left hand over. I turn my left hand over. 1, 2, 3, 4, 5. So just correct your sitting position, all that concentration on quite a tricky move. You may have slouched and twisted slightly. So just check that you're not twisted to one side, that your shoulders are back, that you haven't moved your feet, trying to keep them very still and steady, and then make sure you're sitting straight again. And this time we're going to turn our left hand over. No, our right hand over, sorry. I turn my right hand over. 1, 2, 3, 4, 5. And we're going to twist the stick towards the left. Okay, so don't forget to correct those thumb positions, pulling them out if you can, and to make sure your wrists are also turned down. I turn the stick to the left. I turn the stick to the left. 1, 2, 3, 4, 5. And I bring it back. 1, 2, 3, 4, 5. I turn the stick to the left. I turn the stick to the left. 1, 2, 3, 4, 5. And I bring it back. I bring it back. 1, 2, 3, 4, 5. Last time, I turn the stick to the left. I turn it to the left. 1, 2, 3, 4, 5. And I bring it back. I bring it back. 1, 2, 3, 4, 5. Super. And then bringing that stick down onto your lap, I let go with my left hand and I bring it down. I let go with my left hand and bring it down. 1, 2, 3, 4, 5. Super. So now we're done with this stick. So when you let it go, let's just challenge ourselves slightly to lean forward and put it down on the floor, opening with both fingers as we do. So we're going to bring yourself really far forward down towards the floor, and you're going to open your fingers out. If you can try to put it down without dropping it, then do. But if you need to drop it, that's okay if you can't quite get there. So I lean forward and I let go of the stick with both hands. I lean forward and I let go of the stick with both hands. 1, 2, 3, 4, 5, and I sit back up. I sit back up. 1, 2, 3, 4, 5. Lovely. So now what we're going to do is we've got our 2 shorter sticks this time. So you can hold on to your hairbrushes, your spoons, whatever you've got, and the same things are going to apply. We're going to try and get a nice round position. We're going to try and keep our thumbs out of the way, and we're going to try and keep our wrists turned up as so, and getting a hold with both hands. So take your time to hold on with both hands. I imagine you'll find it easier with one hand and a little harder with another, but take your time and try to get as good a position as you can with each arm together. So I hold on to a stick or a hairbrush in both hands. I hold on to something in both hands. 1, 2, 3, 4, 5. And as you see, I've put them down onto my knees, and then I sit straight, back up, chin up, shoulders back, feet flat, and I sit straight. I sit straight. 1, 2, 3, 4, 5. Now we're going to do the following movements with our right side first, then with our left side, and then we're going to use both sides together. And we're just going to build up a little on a previous session where we took our arms up and out to the side. And today we're going to bring in some what's called crossing the midline. So we're bringing your arm across to the other side of your body. We're going to come right across to our opposite shoulder. And what's important is we're going to try and build the pace a little more than we have in previous ones. So I'll show you as we go, but just follow what I say, repeat what I say and follow the count, and it will all make much more sense to you, especially if you join in saying what we're doing, as your body will know by that connection between your brain and your body of what is supposed to do next. Okay, so I lift my right arm at chest height. I lift my right hand at chest height. 1. I take it to the side. I take it to the side. 2. I bring it back to the middle. Back to the middle. 3. To my opposite shoulder. My opposite shoulder. 4. And back to my knee. Back to my knee. 5. So I lift it at chest height. 1. To the side. 2. Back to the middle. 3. Opposite shoulder. 4. Down. 5. And last time up. 1. To the side. 2. Back to the middle. 3. Opposite shoulder. 4. Down. 5. Really nice. Carry on practicing that with that side. You can do as many repetitions as you like. And one thing to just note, which I didn't say at the start, but when you bring it across to that shoulder, A, don't poke yourself in the face, but B, really try and pull right across to that shoulder and push your wrist down into that shoulder with your elbow slightly lifted. So what we're not trying to do is pull against ourselves here. We're trying to lift it up and push into that shoulder, okay? So the same now with our left side. So I lift my left hand at chest height. 1. I take it to the side. 2. Back to the middle. 3. To my opposite shoulder. 4. And back to my knee. 5. Up. 1. To the side. 2. To the middle. 3. Opposite shoulder. 4. Down. 5. And make sure to watch what you're doing as you're doing it, as well as following me. Up. 1. To the side. 2. Back to the middle. 3. Opposite shoulder. 4. And down. 5. And now we're going to try and combine those two movements together. So moving both sides of your body at the same time and opposite directions. So it will really get your brain working, trying to work out which body part's supposed to go where. But take your time with it and think it through, and you will be able to break it down in those movements. As I've said before, the movements can be small. You can be lifting to here, out to here, across to here. It's better that you are joining in, telling your body to move and doing something than not doing it at all. So don't worry if you're not getting as much or as bigger movements as I'm demonstrating. That's really just to show you the breadth of movement that we can aim for in the long term. Okay, so both sticks at chest height. 1. Both sticks to the side. 2. Back to the middle. 3. Opposite shoulders. 4. And back to your knees. 5. Again, up. 1. To the side. 2. Back to the middle. 3. Opposite shoulders. 4. Down. 5. Up. 1. To the side. 2. Back to the middle. 3. Opposite shoulders. 4. Down. 5. Lovely. Well done. Really good. So we'll just keep hold of these sticks for our final movement now, okay? So hopefully you're not too tired. Just have a check though. I had myself lost my position and slumped a little in my sitting. So bringing that bottom back, correcting your position on your foot plates or on the floor, bring yourself as straight as you can, trying to push up against the back of a chair if you've got one. And this time what we're going to do is we're going to move our arms in opposite directions at the same time. So what we're going to do is we're going to be lifting one arm up. I'm conscious that you can't actually see my whole arm. I'm going to come back slightly. Hopefully you can see a bit more of it. Okay, so yeah, up to there. And then we're going to change in this direction. So we're going to move one arm down while the other arm comes up and back, like so. So we're going to start off slow. I'm going to gradually build pace with this and move a little more and a little more. If you're able to get really high up, right up by your ear, please do. If you're able to keep your elbow as straight as you can, please do. But even if you're able to just do this to chest height, then that's absolutely fine. And even if you just need to lift one and then the other, that's also great. But ideally, we're trying to get them moving opposite and at the same time to try and get both sides of your brain working together to hold control over your whole body. So keeping that sitting position nice and straight, I lift my left arm up. I lift my left arm up. 1, 2, 3. And I change hands. I change hands. 1, 2, 3, 4, 5. I change hands. I change hands. 1, 2, 3, 4, 5. Keep watching your hands as you do it. I change hands. I change hands. 1, 2, 3, 4, 5. I change hands. 1, 2, 3, 4, 5. And then we're going to speed up just a little. Change hands. 1, 2, 3. 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 And even faster again. Change. 1. Change. 2. Change. 1. Change. 2. Change. 1. Change. 2. And stop. And relax there. Lovely, well done. So the last thing to do is to pop those sticks back down on the floor. We're going to do just what we did last time. We're going to lean forward if you're able to, or if that means leaning forward to give them to somebody in front of you. If you're in a wheelchair, perhaps that's fine. But leaning forward and I put the sticks down. Leaning forward and I put the sticks down. 1, 2, 3, 4, 5. And I sit up. I sit up. 1, 2, 3, 4, 5. Great, that's it for today. Well done. If you manage to keep up with any of those tasks, it's really good. They aren't simple. They're using lots of body parts, lots of different directions, and the whole of each of your arms from the very fingertips right up to your shoulders. So well done. And not only that, but you've also been working the whole of the rest of your body to maintain and correct regularly a good sitting position. So all really worthwhile, lovely, active, participating movements to get you going and keep you going. We really hope that you've enjoyed today's session. If you've got any questions about any of it, please comment, please like, please share, and please point us in the direction of anyone you think might benefit from them. Thank you so much once again for taking part in our active movement sessions, and we will see you again next time. Thank you.